Welcome to our webinar. My name is Janet Farrer. I'm President-elect of UCU, the University and College Union. I work in an FE college. I work in trade union education, so my main day job is training trade union reps. So just a few housekeeping issues and a few bits and pieces to introduce. The first thing is that this is going to be strictly 1 hour, so we will finish promptly at 6 o'clock, and hopefully you'll all be ready for your tea by then, or insert regional equivalent. We're very lucky to have with us reps and members from all of the trade unions in further education. We also have reps and members from adult and community education and prison education. We're also lucky to be joined by our employers from FE and also the employers from adult and community education, which is HOLEC, so the FE employers, the Association of Colleges, and also prison education providers. We think we also have with us representatives from the Department for Education and the Ministry of Justice, which covers prison education. So welcome to everybody. This is a really good opportunity for us to show that we're working together in these unprecedented times. But do bear in mind, everybody that is in the room, when you are putting your things in the chat box or in the questions, that please don't criticise your reps or your employers. It's probably not the best idea. So just a few technical issues before we start, a few housekeeping bits and pieces. This session is being recorded, so hopefully that means that lots of people will have access to it after the session. They can see all the mistakes that I make. In terms of the agenda, we're going to have a brief presentation from Alex Lancaster, who's UCU's Head of Health and Safety, and then a brief presentation from Bud Hudspeth, who is one of the National Health and Safety Advisors for Unite the Union. And then we've got a series of pre-prepared questions that have been submitted from the unions and from the employers, which include common themes that are coming through from their members. And then if there's time, we'll try and take some questions from the question and answer facility. I can see a couple of you have found it already, which is great news. So it really does depend on whether or not we've got time for those. Obviously, anything that we don't cover, please do make sure that you have a look on either your union's website. There will be a COVID section with lots of guidance on there, and I'm sure that's the same for the employers also. So please do have a look, and obviously from the union's point of view, if there's anything that we think needs being added to our frequently asked questions or to our guidance that comes up that we haven't considered, then obviously we'll take that into consideration. So just one brief thing before we start. In an ideal world, I would like to do a minute silence. That's not going to be practical in memory of George Floyd and in support of the Black Lives Matter movement, which I know has touched so many of us at the minute. So unfortunately, because of the kind of nature of this, if I do a 1 minute silence and people come in, they won't necessarily be able to recognise that they're not having a tech issue, etc. So I'd just like to mark that and note that, and hopefully everybody can accept that by acclaim. Okay, right, so moving on. I would like to hand over first of all to Alex Lancaster, who's the Head of Health and Safety for UCU. She's going to talk for a few minutes and then I'll hand over to Bud. So Alex, please.
Sorry, unmuting. Hello everyone, thanks for listening in today. So UCU, as other unions, have produced quite a lot of guidance on what a safe return to the workplace could look like. So we've put on our website, you'll find FE guidance on a return to work, stuff on hazards and controls, the 5 W's, which is about who, what, when, where, why, to be considered before we look at returning to the workplace, and also a branch action note as well. So the aim, of course, is to familiarise our reps with the health and safety legislation and to enable them to properly scrutinise the risk assessment process. So as part of that, we do outline what the employer's duties are. And obviously this isn't comprehensive because there's a lot of duties under health and safety legislation, but these are what we see as the key duties of employers. And they are, of course, to protect the health, safety and welfare of anyone who comes into contact with their business. So in that regard, we're looking at the employees, but employers will also be looking at students, contractors, visitors to the organisation and so on. So employers have to put in place preventative and protective measures to protect their workforce and anyone else who comes into contact with their business. And to do that, they will be required to conduct suitable and sufficient risk assessments under the Management of Health and Safety at Work regs. So as part of that, we need to consider what a suitable and sufficient risk assessment would look like. So employers do have to put in place and do have to appoint competent people to undertake a risk assessment. Now, a competent person under the legislation needs to have the knowledge, ability, training and experience and apply that to the workplace to ensure that they capture all the hazards and that they can successfully evaluate the risks. And they do that by consulting with unions and employees when they do that. So what happens in practice and any non-routine tasks all have to be captured as part of the risk assessment process. So what is a hazard? A hazard is something that has a likelihood to cause harm, and a risk is the likelihood of that times the severity. Now with COVID-19, we know that the symptoms can range from mild to severe to fatal, so the potential severity is very, very high. We know that COVID-19 is widespread in the community. While some infection rates may be dropping and we have peaks and troughs in different areas, there is no track and trace system in place and there's no cure for COVID-19 as we speak, and there is unlikely to be for some time. So with that in mind, the risk assessment really has to look at what we refer to as a hierarchy of control, and they are principles of prevention. So the first step in a hierarchy of control to control these risks is to eliminate the risk and control it at source. Now, at the moment, most of our employers have people working from home, teaching online, etc. And that is a good first step. That is a good way of eliminating the potential risk posed by COVID-19 in the workplace. Beyond that, employers then have to consider things like substitution, engineering controls and administrative controls. So different ways of working, physical barriers in the workplace, anything that could prevent people being exposed to COVID-19 in the workplace. So anything that prevents the transmission of that virus. Now, a lot of employers are starting with generic risk assessments, and also we would want them to look at specific risk assessments as well. If I could just go back a step actually, so where we talk about the scope of the risk assessment and the hierarchy of control, after engineering and administrative controls, we also look at PPE. Now PPE is the last measure in the hierarchy of control because it can fail and it is the weakest of all the control measures. And as we know, PPE is very difficult to find at the moment. The NHS and workers who have to come into contact with infected people are obviously prioritised in that, but there are other types of PPE that we can access, and for that reason, things like face masks are now being considered on public transport and in any communal areas and so on. So if we go back to where employers are often starting, they're starting with generic risk assessments, and that is of course a good first step, and they're identifying a whole scope of potential hazards in the workplace, and they're looking at who could be impacted by these hazards and where they could be impacted and how. And that really has to follow a systematic approach to capture all those hazards so that we can identify suitable controls that eliminate the risk and reduce risk levels to the lowest possible level. And many employers are allowing staff to work from home, but as we move back into the workplace, what we need to do is identify those groups that are at high risk. So for instance, we've got older age groups, we've got staff with underlying health conditions, we've got pregnant women, and we've got emerging evidence that suggests that BAME communities and also men are at greater risk of contracting COVID-19 and having poorer outcomes as a result. And so because of that, we want those people to be identified specifically in a generic risk assessment, as well as any specific local area or activity-based risk assessments that are then subsequently developed. As part of the risk assessment process, employers do have to record their findings, and government is of course encouraging employers to publish those findings as well. And when they review and produce these risk assessments, they must consult with health and safety reps. Health and safety reps are, experts in the workplace. They have closer access to members and employees, and they are well equipped to support employees and work together to identify these hazards and suitable control measures. So as reps, you need to be constructively critical of employers' risk assessments. We need to work together to identify all the potential hazards. We need to follow a hierarchy of control. We need to ensure competent people are appointed to undertake these risk assessments, and we need to make sure a whole institution approach is followed. In terms of the guidance that UCU has put out, we also have put forward a branch action checklist, and one of the things in that is that we would like employers to put in place a risk management framework, so identifying who the health and safety arrangements, the points at which UCU would or the unions would come in to consult on that, on these procedures and risk assessments, and also who their competent people are. Now, obviously, that will depend on the size of the workplace, but this risk management framework does need to be in place, and then the risk assessment process will feed into that. We also want to put in place a procedure for serious and imminent danger. Now, Reg 8 of the Management of Health and Safety at Work regs does require employers to put in place a procedure for serious and imminent danger. And we think this is a good way of ensuring members are protected and understand, the steps that they can take if they feel they're at risk of serious and imminent danger, which we do feel is quite likely given that COVID-19 is widespread and uncontrolled in the community, and given the potential, risks to individuals who are returning to the workplace and the obvious fears that people will have about any return. As well as that, as a union, we will be advising members on their individual rights under the Employment Rights Act, under section 44, with the right to remove yourself if you believe there to be a serious and imminent danger to your health and safety. And collectively, we need to look to put in place these procedures to ensure that people are safe when they're at work. Now, the scale of this is obviously quite huge, and we are conscious that health and safety knowledge and capacity across organisations and institutions can be limited. There are people who have a lot of knowledge and expertise, but the scale of COVID-19, and the amount of risk assessments and scrutiny that needs to take place means that we do need to work together to maximise our health and safety knowledge and expertise. And that will obviously result in a safer workplace. So rather than go on about the basics of risk assessments and health and safety legislation, I'll move to Bud, and then hopefully we can move to questions as well.
Okay, thank you so much, Alex. That's great. This is brand new technology to all of us, by the way, so apologies if anything goes wrong. I should probably have said that at the beginning. Can I bring in Bud Hudspeth then, who is the National Health and Safety Advisor for Unite the Union?
Thanks, Janet. As Janet said, I'm Bud Hudspeth, National Health and Safety with Unite. Clearly, Unite, we've got well over 1 million members, and we operate across many sectors. So we've got a lot of experience of dealing with all sorts of sectors as well as FE. In FE particularly, our major interest is obviously with support workers of all types. So this could be technical staff, admin, estates managers, maintenance people who are in the workplace most or all of the time. So clearly it's important what controls apply to them. There's no point in me repeating many of the things that Alex has talked about. What I would emphasise is a couple of points she made was the importance of safety rep involvement, the importance of making sure that measures that companies or sorry, colleges choose to introduce are practical and will work in practice and address all of the issues that people on the ground face. Within that, the most important areas to us are maintaining social distancing, the 2-meter rule whenever possible, regular hand washing and extra cleaning measures. So you have a regime that covers all those things. We'll probably come on to talk more about face masks, whatever, but there are issues around that. And there's also issues around BME, and again, that may be something we come back to, but we're about to publish some more information on BME risk assessments. A lot of the information that we gather, and like UCU and other unions, we have a major problem of keeping these things up to date, but anything new or updated goes onto our website. I mean, the easiest way to find it is probably if you Google Unite and COVID, you'll get there. And what you'll see there is, like other unions, huge amount of information, not just on health and safety issues, but also on issues around employment and legal questions. And that's set out in a way that tries to answer a lot of the common problems and links to various sources of information. So that's a good place for anyone to go, and that's available to anyone to look at that site and cover those things. And within that, there's some guidance on risk assessment, necessarily fairly general, but includes quite a lot of discussion around the hierarchy of controls and those kind of things, and the importance of the way that any organisation addresses its risk assessments and so on. But I'll come back to the main point again. I think the involvement of reps on the ground is absolutely vital. There's clearly a legal duty to do that. The government guidance has re-emphasised that, and I think that's something that we emphasise all of the time, that involving the people actually doing the work is vital to getting the right procedures, but also maintaining confidence from the workforce in the kind of measures that are being applied. Because what we're finding is, whilst probably a majority of our members are keen to get to work, there's a significant minority who are understandably frightened of the situation they might find themselves in. So one of the things that employers need to do is to make sure that they're able to offer assurances, and that when people come into the workplace, which will be very different from the workplace they left because of the controls in place, that they're confident and satisfied that it's a protected environment and they're going to be safe at work. So that's kind of important. So I think communication, as Alex said, is absolutely vital. And I think a lesson for many employers is they need to make sure that people understand exactly what the controls are, and preferably they know what they're going to be before they get there, that they recognise the employer has done things in consultation with the workforce and have come up with procedures that are going to work and protect people. So that's probably enough just as an intro.
I can't believe I've just made the same mistake again. You think I would have learnt by now, but luckily someone's frantically waving at me, so I think this is all part of the fun. So I was just in the middle of saying thanks so much to Bud and to Alex for those introductions, and I think we should move now to the pre-prepared questions, or maybe I should just hand over to a different chair who knows how to work the mute button. That might also work. So the first question that we're going to come to is actually from one of the Association of Colleges members, and the question, which I'm going to put to Alex and then to Bud if he's got anything additional to add. So the first question, Alex, is, in your view, what is the single most important concern that FE staff have about returning to work? And how would you wish colleges to mitigate this concern? So just to summarise, what is the single most important concern that FE staff have, and how would you wish that to be mitigated? So Alex.
Unmuted, thank you. So the single most important concern is obviously around the safety. You know, people will be concerned about whether they're going to contract the virus, they're going to be concerned on whether they're going to spread it to their loved ones who may be vulnerable, and obviously those in high risk groups are going to be more concerned. There's emerging evidence all the time identifying different risk factors, so that needs to be taken into account. So yeah, so I can't remember the second part of the question, but you know, they'll want to see that employers are putting in place suitable and sufficient risk assessments, that they've been consulted on those controls, and that their unions have been consulted on the controls as well. And you know, that employers are publishing those risk assessments so that you can see what should be implemented. And of course, if there's any safe systems of work that need to be developed, then staff will also need training on those safe systems where appropriate.
Thank you, Alex. I'm getting the hang of this now, I reckon. Bud, would you like to come in on that one?
I don't need to have much, because I think I absolutely agree with Alex. I think it comes back to that point I made earlier on, is that it's all about involving people and giving people reassurance that the right controls are in place and everything they need is covered. So it comes back to that communication issue. Because that's what people worry about, I think, is that when they come back to the workplace, the measures that need to be there aren't there. And what I'm finding is that people are really aware of the kind of controls that should exist, and they expect to see them. So if there's something missing, they're very quick to identify it. So I think communication is the key issue.
Okay, thank you, Bud. I'm getting the hang of it definitely now. So she set herself up for a fall. Right, the next question is a UCU question from a UCU member, Alex. So I'll hand this over to you, which is, does the employer have to involve trade unions in carrying out a risk assessment?
Yeah, they do. So as a recognised union in the workplace, the employer's got a duty to involve union appointed or elected health and safety representatives in risk assessments, and you know, to consult the unions in all health, safety and welfare matters that could have a substantial impact on employees. So you know, they can consult with unions on the arrangements for the appointment of competent persons. They have to provide any information that they are obliged by law to give to employees. You know, unions should be consulted on health and safety training. And you know, it's important in that regard that we make sure our branch negotiators who are involved in any risk assessment process are appointed as health and safety reps if they are not already, to ensure that they can access, you know, the statutory rights afforded to them in the safety reps and safety committees regs.
Thanks, Alex. I'm just going to add an additional question from a UCU member, which is connected to that one, which is whether or not staff have the right to see that risk assessment. So if I could come back to you, Alex, and then I'll see if Bud's got anything to add on either of those.
Yeah, so staff, you know, they do have the right to see the risk assessment. The legislation states that employers must inform staff of the risks to their health and safety and the control measures that are in place. Now, obviously, we think of a specific form in that regard, but, you know, if they've got 5 or more staff, then they must publish the key points of the risk assessment and make that available to staff. And the easiest way to do that is to publish the risk assessment so that all staff can see the control measures that are in place and, you know, the controls that apply to them and any safe systems of work as well. And that is why government guidance is now advising employers to publish their risk assessments. And as Bud said, you know, this will instill confidence in the workforce, and you know, it will reassure people that the employer is taking the right steps and consulting with the trade unions.
Thanks, Alex. Do you want to give me a wave, Bud, if you want to add anything, and then yeah, go ahead.
I would just add that the importance of people being involved is so that they can challenge what's in there. You know, that there may be things in the risk assessment that people think won't work, or there's things that are missing, and that's part of the point of involvement, is to make sure that that risk assessment covers all the things that are necessary. We don't want to end up with a situation where something's going on and people saying, hang on, the risk assessment never mentioned this. You know, that we're always trying to get everything in there and get an answer to problems and so on. So that's one of the reasons we want reps to be directly involved, staff to get that information, so questions can be raised and clarified, or assessments changed if necessary.
Well, thank you very much. I hope you both got some water handy. It must be hard just talking constantly. I'm used to it, to be honest. I never shut up. Right, so on that, the next question is from Unison. So I'm going to put it to Bud first of all. The question is about capacity. Do you have any suggestions on how best to keep up with the amount of risk assessments? Many colleges have few reps and a number of sites to cover. Risk assessments are therefore sometimes signed off without the recognised trade unions seeing them. So it's about whether or not you've got any suggestions on how best to keep up with the sheer volume of risk assessments. To Bud.
Well, I'm not clear why there should be a severe volume of risk assessments. I mean, the duty to do a risk assessment has been there for many years, so there should be existing risk assessments for most activity. What's happened is there needs to be the new requirement, in effect, is that there needs to be new risk assessments, or a new risk assessment to cover issues of COVID-19. So all the other things will apply, and it's about the additional stuff. And an awful lot of it is generalized, and there's a huge amount of guidance out there, you know. So I think most employers' organizations, most unions are producing guidance on what a risk assessment should entail. Part of the problem, a lot of information is there from the government, although part of the problem that we all have is trying to always make sense of what the government's issued. But there needs to be a risk assessment there. If there's a problem of encountering or identifying reps within an organisation, I mean, what the employers should do, at the very least, is make contact with full-time officials who represent different unions in the different workplaces. So to me, there's no excuse for there not to be some contact with trade unions at one level or another. Clearly, we would expect reps in workplaces to be the first to be consulted. But if there is an issue with that, then there are other people available. For those people in Scotland, of course, the Scottish Government last week offered or suggested that all workplaces should have available to them safety reps from other organisations. And so that applies. We're saying and talking to a number of organisations in different sectors about using reps from, let's call them host workplaces, to contact companies in the supply chain, if you like, or part of the kind of working chain of colleges and employers and whatever. I mean, for instance, there'll be apprentices coming into colleges from different companies, and there are reps in many of those companies who could be consulted and involved in developing approaches to health and safety that cover not only those apprentices but also other people in the workplace. So I can't see a good excuse not to involve unions, and even if there's a lack of reps at a local level, or there's a problem identifying them, or they're currently at home or furloughed or whatever, then there are always full-time officials who've got wide experience of dealing with lots of different workplaces who can have an impact and have an involvement.
Thank you, Bud. That's brilliant. Alex would like to add something on this one.
Hi, yeah, thanks, Bud. I agree with everything Bud's just said, and it was a very comprehensive answer. I think the only thing I would add is that, the generic risk assessments can inform the more specific activities. So if you make sure as a rep that that is robust and it's capturing as much as possible, then that will ensure that hopefully some of the risk assessments that are coming from this generic risk assessment are also suitable and sufficient. But I take the point that, a lot of workplaces just don't have the spread. And I know Bud's mentioned, unions standing in for each other or roving reps and those sort of ideas as well, which can be really useful. And I know in some workplaces, working groups are being set up or subcommittees of the safety committees to specifically look at COVID-19, and they can be a good place to share the workload and share the expertise across the organisation, across unions and across employers to really scrutinise those risk assessments so that you don't feel like you're an individual in one building looking at 20 risk assessments. You go and sit on a committee and you scrutinise the process and you scrutinise, the risk assessment process itself.
Thanks, Alex. That's great. Right, I'm trying to be as fair as possible and spread these out. So I'm going to take the next question from the National Education Union, the NEU. Should we be expecting students to wear face masks if any face-to-face contact is planned? But just in addition to that, and I'm going to come to Alex first, I'm just going to add a question that popped up in the box that I saw. From a member who said, our college is encouraging wearing face masks or coverings. How much protection does this give and would it be sufficient? So this is just a general question really on face masks for face-to-face contact. So I'll go to Alex first.
Okay, so my understanding is that face masks will stop the spread of the virus to a certain extent. So they will stop those airborne droplets. So if social distancing or if there's a lot of people in a room, then it can minimise the spread of the virus. So face masks can be a useful control measure. Of course, whether they should be applied or not in any given setting has to be, you have to consider who is there, who is taking part, what are their needs, what are their, is it accessible? You have to look at the equality impact of these sort of things as well. But of course, you do have to prioritise health and safety. So if that measure can't be implemented, then, you take a step back on the hierarchy of control. You look to eliminate, you look to put in place administrative controls. Is there an alternative way of doing this teaching? That means that we don't even need to have face masks. Do we change our curriculum or our assessment methods? So all these things need to be considered when you also make a decision on whether face masks should be worn by staff or students. But it is, of course, something that is increasingly being brought in because it does create a useful barrier around the face to the spread of airborne COVID-19 droplets. That's a non-technical term.
Thanks, Alex. I'm a fan of non-technical terms. That's my modus operandi. Bud, do you want to add anything on that one?
Yeah, I mean, it's a really thorny question, but what I would say is to follow up really from what Alex has said, that the most important thing is to look at social distancing, hand washing and extra cleaning regimes and look at ways of achieving particularly the social distancing. So things have to be done in a different way. And what organisations do in generally, they're saying, well, we can't have as many people in an area as we used to have if we're going to maintain social distancing. So that should be our aim, always to create those issues. And then you don't need face masks. I mean, face masks themselves, if you want a face mask that's going to protect the individual from the virus, then you need high performance masks that are close fitting, that are so-called FFP3 and FFP2, that achieve a certain percentage, usually up to 80–90% effectiveness in controlling the virus. Simple face masks or face coverings are not going to protect the individual from the virus. They may protect others from you passing the virus to them, although even there the kind of evidence is a bit iffy really about how good that is. I mean, it's probably better than nothing, but it introduces all sorts of issues about how you put on a face mask, how you take it off, how it's disposed of. So if there's going to be use of face masks, there needs to be a lot of additional training in the use of those face masks and how they can be used safely and how they can be disposed of safely. So it introduced lots of other points there. To me, if you achieve social distancing and the other measures, the need to wear a face mask is reduced considerably, if not eliminated. And what organisations, including colleges, have to do on occasions is take that decision that says, no, we can't do this safely. And we have to, if we can't do it another way, we might have to stop doing it. And I know it's a tough decision to make, but that's what some organisations are doing. They're just saying, well, no, we can't do that job in that way anymore. So we have to find a way of doing it differently. In a college, I think there should be a huge emphasis on maintaining that distancing between people, whether that's in corridors, support areas, or in classrooms. It's achieving that, or in sort of technical classes, finding ways to achieve that. And if you can't do it, first measure should be to look at the hierarchy and decide whether or not you're going to do that job at all.
Thanks, Bud. Appreciate that. So Alex mentioned equality issues as part of that that answer. So I'm just going to go back to a question from an AOC member, which is whether or not you've got any additional advice on how we support BAME staff back at work in the context of the global pandemic. And actually, there has been a question through on the chat box whether or not there is a standardised template for BAME and other vulnerable groups. So if I could bring that in at the same time. So just to summarise, any additional advice on supporting BAME staff and whether or not there's a standardised template. So can I come to Alex first, please?
Yeah, so in terms of supporting BAME staff, so Black, Asian and minority ethnic staff in the workplace, you know, we need to consult directly with these staff as well, but also include this group within the generic risk assessment because they are at greater risk of contracting COVID-19 and suffering poorer outcomes. So, you know, if you look at the hierarchy of control, the best way to eliminate that is to find to allow those staff to work from home or to continue to work from home, to maybe look at alternative duties if that's appropriate. And then maybe to minimise the amount of time spent on site and the contact with other people. So these are all sort of the way you will work your way down the hierarchy of control. And what is appropriate obviously depends on what they're being asked to do, who they're going to come into contact with, and with the primary aim, of course, of protecting them from harm. And that is the most important thing. And I think a lot of difficult discussions have to be had, and we do need to collectivise this issue through the generic risk assessment process and not just look at individual risk assessments to separate out these issues, because it is a collective issue as well as there being individual factors to consider as well.
Thank you very much. And Bud, do you have anything to add on that issue?
Yeah, I think Alex is absolutely right, and you know, it's about making sure that BME is
Sorry,
included.
Bud, I don't think you're on the screen yet. Just bear with me one second. It looks like we're having some kind of technical issue. It was coming. So we'll, oh, I can see Bud now.
Yeah, no, Alex, I absolutely agree with Alex that BME needs to be part of the risk assessment. I mean, this is based on some stuff from Public Health England that's been very well publicised that's showing they're a more at risk group, and so that needs to be considered. And I think that idea of I mean, if it's essential that those people need to be brought back into the workplace, and that's a big question that needs to be asked first. They should only be coming into areas where we're absolutely confident of their protection and whatever. I'm not sure there is a template as such. As I said, Rob Miguel, who's my sort of colleague within Unite, has produced a risk assessment guidance for BME. I don't know if it's on our website yet, but it will be, I think, shortly. So that might be worth having a look at. But it makes those points really that it's making sure that you absolutely meeting the protections there for everyone, but you're also considering whether BME people need to be brought back into the workplace, and if they are in the workplace, whether they can be assigned tasks that offer them the maximum protection, and not expecting them to be put into situations where perhaps social distancing hasn't been achieved and so on. So that's the essence of it. And the important thing now is that we're considering those groups and one or two others as high-risk groups need to be addressed specifically.
Thank you, that's really useful. Okay, so I'm aware of the time. We've got about 15 minutes left and we will be finishing strictly at 6 o'clock. I want to try and make sure I've got a question in from each union and from each employer so that has submitted one. So the next question is going to be for Bud and it's from the GMB, from a GMB member. What should support staff members generally do to ensure that any risk assessment in regard to their college reopening or their institution reopening is being implemented properly by college management? I'm just going to repeat that so that because it's quite a wordy one. What should support staff members generally do to ensure that any risk assessment in relation to reopening is being implemented properly by college management?
Okay, got to press the right buttons. Yes, I think it comes back to, in part, the point we made before about involving people. So clearly, in terms of the risk assessment and measures that are introduced, support staff, particularly in issues that directly affect them, need to be involved. And on a general level, on all measures, there needs to be recognised that there's a review process, that most risk assessments will not be the finished article, and there'll be living documents. We've already talked about the fact that things change from one day to another. So there needs to be a constant review process. And what will happen, and what does happen, is there will be things that people have forgotten or missed out or they haven't considered properly. And so if there is so there's two sides of it. There's some things that are completely unaddressed. The other one is where the risk assessment says this needs to happen, and in reality, it doesn't happen. And that's where those assessments need to be challenged. And that's why involvement of reps and people is part of that. And one of the things that happens in some areas is there is a formal review process that actually identifies a means by which issues can be raised, that there's an absolute assurance that no one is going to be questioned for raising issues that might be awkward, that there'll be no comeback to them, and there's a process for that to go on. And what organisations, what colleges might want to do, clearly, if something's desperately urgent, you should be able to raise it straight away. But another approach is to say, well, we'll have a regular review, whether it's weekly or twice a week or whatever, of all assessments, so we can pick up things that don't work or are a challenge, or where someone's perhaps managed to implement a measure, but they've had to go through a difficult process to get there. So I think that's the answer, is to say a risk assessment isn't a be all and end all that, you know, that is done forever and a day. It's something that will change over time. And the emphasis has got to be on reps and people on the ground, raising it with the reps to say, this didn't work, we need to rethink it.
Thank you. I'm going to invite Alex to see if she wants to add anything to that, but there is another additional question, if I could sneak that in from someone on the chat, which was, should there be a union rep in college when it reopens? So should there be one on site? So if you could answer that, Alex, and anything else in addition to Bud's answer.
Yeah, so the only thing that I think I'd add to what Bud said is that, you know, you can request that there is sufficient training in place across the organisation. You know, the culture of workplaces will vary, the health and safety culture will vary workplace to workplace and area to area. And if you've got a worry that there's managers who may not implement these controls, there's likely to be a health and safety training need there. And these things need to be, you know, identified and addressed before the return to work. And so that is, you know, just an additional thing that you could scrutinise and look into. In terms of, what was the question? I'm so sorry.
So the other question was about whether or not there needs to be a union rep on site when the college reopens. And actually we have had somebody else asking about that, whether or not the rep has to be present when risk assessments are taking place.
So the rep doesn't need to be present, but they need to be involved. So we do have a lot of reps that are being requested to go on site to, you know, consider and to view any potential hazards, like the size of the classroom, whether there's welfare facilities nearby, how narrow the corridors are. That can be really useful, but again, it does need its own risk assessment to ensure that our reps are safe when conducting any of these sort of walkthroughs of the workplace. And they are useful in informing a risk assessment. But, you know, it is the employer's duty to do this. And we can see and scrutinise those risk assessments once the employer has completed them, and we can add to them through consulting with our members and employees across the workforce. And so it's not essential that you have to have someone visibly present, but they should have been consulted in advance.
Thank you for that. I'm going to push on with a question from Holex, who are the adult and community education employers. What advice are UCU giving members re face-to-face teaching? Alex, please.
So the advice will vary again from workplace to workplace, but, you know, we are advising our reps that employers should be eliminating these hazards. So obviously, where possible, as much online teaching to continue as possible. Anything that can be done from home should continue to be done from home. And then we're working with the employers then to identify any areas where they feel, you know, people do need to come into the workplace. And as Bud has said earlier, you know, we have to ensure that there's suitable controls in place to ensure that those risks are at the lowest level as reasonably practicable. And, you know, and we just need to make sure that those risk assessments are constantly scrutinised and reviewed. So.
Thank you, Alex. That's brilliant. So I can't leave out Unite the Union because that would be remiss of me, Bud, wouldn't it? So I'd like to ask you, what should we do if we have a student or staff member exhibiting symptoms in the college?
Yes, what there needs to be is a safe way of isolating that person and safely taking them home. I mean, they've got to be taken out of the workplace. If there's any suggestion or indication that the problem occurred because of exposure in the college needs to review its measures, because if it's felt that it was related to exposure in the college, there's clearly something wrong with the measures that are in place, so they need to be checked and double checked. The other issue, it kind of raises this question of test and trace, because if someone develops the problem with the virus, then they should be now subject to test and trace. But there's some concerns about the time it takes to test and the time that tracing might occur. So I think employers need to think about, if they get a clear case, that they start to identify potential contacts, and a contact's someone who has been exposed within 2 meters of that person without adequate protection for more than 15 minutes. So if there are people who fit into that, then the college should be considering whether they should themselves be isolated and advised. I mean, clearly the test and trace system, if it works well, should pick up those people fairly quickly, but at the moment it's a bit unclear how quickly that process is going to come about. But I mean, it's like in the conventional health and safety sense, if someone exhibits a health problem that you meant to have controls to deal with, then to me, there's potentially something wrong with the controls, and that needs to be addressed as a matter of urgency. The other thing that again, the general advice out there is, if there's someone who's operating in an area that they seem to be suffering from the virus, there needs to be kind of deep cleanup procedures in place to correct the situation, whatever. And that's, I think that guidance is pretty well set out in the government stuff and general practice. So that's perhaps the kind of things that ought to happen. What most organisations are starting to put in now is to identify a kind of isolation room that people can go to initially before it's worked out how best for them to leave the workplace and return home to self-isolate there.
Thank you, that's great. I'm just going to bring in a question for Alex, because I'm aware that we haven't mentioned our colleagues in prison education specifically yet. So I just wondered if there are any specific concerns for prisons in terms of the risk assessments, please, Alex.
Yeah, so I mean, the specific concerns for the prisons are largely to do with the fact that they are a contracted service by HMPPS, and so, you know, we need to ensure that that the prison education employers have sight of the HMPPS risk assessments, and that we're working together with them to manage the risks in the workplace. They also, you know, will need to consider the health and safety culture within that workplace and the students that they will be with, and the type of activities that they will be undertaken in the prisons, and whether they can be whether suitable controls can be implemented to protect people from harm in those cases. So it's a different working environment, so it does have its own considerations, but generally the risks of transmission and the controls that we would put in place would be the same as within a college environment as well. It just might be that there are additional restrictions that need to be taken into account, certain controls that won't be implemented, and I think, as Bud said, some activities just won't be able to take place if we can't guarantee the safety of staff in those areas.
Thank you for that, that's great. I'm going to come to Bud with the next one, which is more of a general question that came up earlier on the chat, which was, should employers consider travel to work risks as part of the risk assessment?
Yeah, the simple answer is yes, and I think the other consideration ought to be about possible travel between sites where there's some form of transport that takes people from one place to another, be that staff or students or whatever. And it's a big issue, and I think that's an issue. The issue of travel to work or to whatever is a big issue for lots of organisations. I mean, it's come to the fore in London in particular, but it's true in elsewhere, about travel on tubes and buses and trains. So we've seen lots of moves to minimise travel on public transport, and organisations need to consider that. I mean, the kind of measures are in place that aid other things as well, are to stagger attendance hours, to perhaps in order to cut numbers, to have people come in 1 week and not the next, or one day and not the next, and so on. So yes, they need to take all those things into account, and there's quite a lot of guidance about that. And within that, you know, the important thing is to be able to maintain social distancing. Now, employers don't have a huge amount of control over the actual public transport itself, but they can vary the start times and finish times and what have you. And they can also put in measures to encourage use of bikes and walking and all of this to get to places if they're if the colleges are reasonably accessible to various people. Where people are travelling by car, there's an importance to maintain social distancing when you can, and often that means only one person per car. But if they're using minibuses, whatever, there are ways of social distancing within a minibus But that means, again, you have to limit the number of people who travel. So yeah, it is an important factor, and it would be unwise to do all the other things and not address how people get to and from the workplace or between workplaces.
Thanks, Bud. I'm going to live dangerously and try and squeeze in one tiny little question for Alex. So if you can just be super brief in your reply, even though it's quite a big question. What mechanisms are available to address health and safety management teams that refuse to acknowledge the limitations of their competent persons? So just to clarify, that was a question that came in earlier, and hopefully we all know that competent is being used in the health and safety way. So what mechanisms are available to address any health and safety management teams that refuse to acknowledge the limitations of their competent persons, please, Alex?
Okay, so this is about if you've got a workplace where you don't feel they're competent enough to implement or consider the risks. So, you know, you can take that to your safety committee. You can try and involve as many people as possible. You can take it to the safety advisor if there is one in the organisation. And you can also raise it, any concerns with your union regional officials, for instance. And you can start to escalate. You know, you may have a procedure about, you know, bargaining agreement with failure to agree, so you can enter a dispute. You can report things to the HSE and also to the TUC, who are also keeping track of a lot of these issues. But the important thing is that, you know, we can escalate when we don't believe employers are following the legislation and they're not competent. But we also need to be clear on why we think they're not competent and what we feel are the suitable control measures that should be implemented. And we need to really try and use as much bargaining as possible to ensure that employers come on board with our way of thinking, and that we can really share our knowledge and expertise on this. And if necessary, you know, make sure that employers are putting people on training. So, you know, we have rights to consultation around health and safety training. So we should be saying, this is what is needed, and we don't believe these people have the skills to implement these risk assessments.
Thanks, Alex. So sorry to hurry you up. It was my own fault for trying to take in an extra question, really. So I'd like to conclude just by saying really sorry to everyone who's put questions or comments in the box that we've not managed to get through, and the questions that were submitted. As you can see, that we've got a limited amount of time. We're all dealing with something that we've never had to deal with before, so we need to keep working together. I'd like to really say that we really appreciate so much Alex and Bud for their amazing contributions, and to everybody behind the scenes at UCU who've made this happen. We really appreciate that so many college managers have joined us this evening, and their commitment to working with us as unions to make sure that returning to on-site working is safe. And I want to thank all of the health and safety union reps who are working tirelessly and will continue to support you through this. So just a reminder that this webinar has been recorded and it's going to be shared. And if these webinars are useful, please let us know, so that we can continue to support everybody. So thank you very much. Take care of yourselves and take care of each other, and we'll see each other soon. Cheers.